Thank you very much, Mr Deputy Speaker, and I would just like to thank the member for North East Bedfordshire for clarifying that I had not voluntarily added my name to his amendments. And I could just open by saying we hear a lot about the nanny state whenever we talk about some of these subjects. But as a surgeon working in A&E and general surgery, I would say the difference when seatbelts came in, the difference when airbags or speed limits came in was just night and day in how much time I was going to spend dealing with people in operating theatres who'd been involved in car crashes. So, sometimes the state does have to take action to protect people's health and well-being. Now, obviously, the focus of this bill is largely about reversing some of the most egregious aspects of the 2012 Health and Social Care Act, and I welcome that. But this section is focused on public health and improving public health. I would say there is no question that obesity and the associated type 2 diabetes poses a real threat, not just individual health, but a threat that will overwhelm National Health Services in the future because of the diseases associated with obesity. But I was surprised when I looked at the original bill that apart from the measures around obesity, there was little in the way of public health policy to actually improve health. There's little enough in this bill around care, but to have so little that's about the promotion of health. It's not the National Health Service that delivers health. I've often said it would be more appropriate to call it the National Illness Service, but who on earth would want to work in something called that? But the NHS spends most of its time catching you when you fall. Health comes from a decent start in life, a warm, dry home, enough to eat, a decent education. Those are the things that deliver health, and there's nothing like that in this bill. Particularly and surprisingly, nothing on reducing harm from tobacco products or alcohol. And that's why I do rise to speak in support of new clauses 2 to 4, which seek to strengthen the health warnings on all tobacco products, new clauses 7 to 10 to allow regulation of tobacco pricing, but particularly new clause 6, because I find the use of sweet flavourings to entice children and young people to take up smoking is indefensible. Absolutely. I will happily give way.
I'm very grateful to the Honourable Lady for giving way, and I heartily commend her for her comments. Does she experience in her constituency the same in mine, that the smoking cessation services are diminishing and becoming less successful? And as the tobacco industry concentrates on a core group of existing addicts, so they are desperate to move down the age range and encourage new addicts to come in. And that's why this element of the new clause is so important.
I agree this is the most important of the new clauses, because tobacco companies are driven to recruit new victims, I would have to say, as a doctor, and they are recruiting them from young people. Obviously, public health is devolved, and therefore we've not seen the cuts in public health funding that unfortunately we've seen in England since 2016, and therefore not the cuts to smoking cessation or sexual health services that unfortunately many local authorities have experienced across England when public health moved into local government. Smoking doesn't just cause respiratory problems such as chronic obstructive airway disease, but it affects all the blood vessels, causing peripheral vascular disease, vascular dementia, strokes, heart attacks, and many forms of cancer, not just lung cancer. Stopping smoking is the best favour anyone can do themselves, but many people require the very smoking cessation services that the honourable gentleman mentioned. I also found it surprising that there was nothing in this bill about tackling not just the health but also the social harms associated with alcohol abuse. Indeed, alcohol hasn't even been included in the definition of less healthy foods, despite it clearly being the case. There is no health argument for alcohol. Now, I'm not saying that people have to abstain, but the research that many people quote where having some alcohol is of health benefit over full abstention, have all been discredited. And that was because people who actually had alcoholic disease and were made to give up alcohol were put in the abstention group and therefore brought their liver disease, their varices and everything else with them. More recent research shows that unfortunately alcohol does cause harm. And it's only about 10, 15 years since we learnt of its association with breast cancer, my specialty as a surgeon. And in that, it is absolutely, the more alcohol a woman drinks, the higher her risk of breast cancer. I'll give way.
I thank the member for giving way. Obviously, as the chairman for the APPG on alcohol harm, part of the issue with treatment, and I think in particular to New Clause 16, is the stigma behind alcohol dependency, and it's still being seen as a personal choice. So whilst we need to overcome this stigma of addiction, first of all, we actually need to be having a conversation about alcohol. So would you agree that actually as part of the treatment, we need to be having this conversation on a national level?
I mean, I would say that really no one who has a health problem should be stigmatised. And having dealt over 33 years in the NHS with many people who were problem drinkers, the public image of someone who abuses alcohol is quite a caricature, whereas there will be many people across this house who will drink more than is healthy for them. And there are many people in middle and upper classes who I have met as patients who had serious alcohol problems. So we should get away from the stigma and the caricature. You will not spot everyone who needs to deal with alcohol just by looking at them. I'll give away.
Poor lady for giving way, and I commend the work of the member for Liverpool Walton in this regard. But would she agree with me that the whys and wherefores are all very well in this debate, but in the end the cuts to local government, which would primarily be providing services around alcohol abuse, have been cut back in the most disgraceful way, and that's why we're seeing this huge increase in the number of people who have passed away from alcohol disease in the last couple of years following COVID.
I mean, there is no question that after public health moved into local government, which you can absolutely defend because, as I said, health is often delivered by things that are nothing to do with the NHS. But the problem was the budget was then cut, and so the potential benefit of putting public health into local government was lost due to the cuts to services. With regards to alcohol not being classed as a less healthy food, with this government I find it hard not to ask why not, and what or who may have influenced that decision. And I certainly support the amendments from the Honourable Member for Liverpool Walton, 11 to 13, which would include alcohol, particularly the medium and high strength alcohols under less healthy foods, so that it was covered by advertising regulations. I also would support his new clause 15, which would mandate much clearer labelling of alcohol units or whatever measure on labels. It's no good just saying drink aware or drink responsibly when actually the consumer hasn't been given the tools on the product to make a proper choice. How much is in this? Why not agree to use a simple, straightforward approach? A lot of the public health advice is in units, so why not actually use that? And then people learn to be aware of how many units have I already drunk today? How many have I already drunk this week? With new clause 17, the Honourable Member for Liverpool Walton is calling on the UK Government to follow Scotland and now Wales by introducing a minimum unit price for alcohol. Now, of course, the UK Government has the advantage in that they could do it by setting alcohol duty based on units instead of classes of drink. Every budget we hear a penny on a pint of beer or so much on spirits. Why not do it by unit? It's much more accurate, and it would still allow the raising of taxation to help fund both alcohol services, but also the public services that are most hit by alcohol abuse, such as healthcare and policing. Under devolution, the Scottish Government, and now the Welsh Government, of course, didn't have that power. Now, over the last year and a half of the pandemic, we have unfortunately seen a big increase in both smoking and alcohol consumption as people struggle to cope with the loneliness and boredom associated with lockdowns and pandemic restrictions. However, the initial valuation of minimum unit pricing in Scotland showed alcohol sales fell by the first time in many, many years over 7% in Scotland when compared with a continued rise in England and Wales. It wasn't possible to demonstrate a reduction in overall alcohol-associated admissions to hospital, which of course may include car accidents or violence, etc. But there was a drop in admissions due to alcoholic liver disease, suggesting that the policy was working. More evaluation after the pandemic will be required, but an immediate impact was an almost 3/4 drop in the sales of cheap white cider, something that is cheaper than soft drinks and is basically a product that is predominantly used by young and often indeed underage drinkers when they purchase this or get someone else to purchase it so that they can drink it at home. That means this sector is literally disappearing overnight. It will be important to review and maintain the pressure of the unit price on a regular basis, because many products that are also drunk by young drinkers, and it's the same issue as young smokers, you're recruiting more people and often you're recruiting them into problem drinking and problem products. Minimum unit pricing doesn't affect good wine, it doesn't affect high-end spirits, it doesn't affect what's sold in a pub, but it does affect what someone can buy in a small shop and then hang out with their mates in their bedroom. Some of these kind of products are not affected by the 50p unit price, and therefore this has to be kept under review. I have to say, I was disappointed that new clause 30, which is listed in section 4 tomorrow, was not included in this section, because this calls for the government to reform the out-of-date Misuse of Drugs Act and devolve it to the devolved nations to allow them to take a public health approach to tackling drug addiction in the same way as we take a public health approach to dealing with alcohol. Such a public health approach has already been demonstrated in many countries across the world, and yet this government keeps sticking their head in the sand. I'll happily give
I'm very grateful to the Honourable Lady for mentioning my new clause 30, which I still hope against hope that we might be able to discuss tomorrow evening. I mean, the point of the clause, and I'm sure she'll agree with me, is that problematic drug abuse is an illness and a social ill, not a crime. And so, our emphasis must be on harm reduction, on treatment and on support for the problematic drug user.
I thank the honourable gentleman for his intervention, and it is the policy of the Scottish Government, and it's absolutely an amendment that we would support if it got voted on tomorrow. As members from the official opposition have said, key to improving public health would be to restore the non-COVID related public health budget in England. It can't hide behind the COVID funding, because that is used up in the pandemic. That is not helping us with smoking, alcohol or indeed drug addiction. But the biggest contribution this government could make would be to abandon their plans for yet another decade of austerity. We hear the slogan all the time, levelling up, but it rings hollow after taking away £1,000 a year from the poorest families and most vulnerable households. Over the last decade, cuts to social security have caused a rise in poverty among pensioners, disabled people and particularly children. We heard Sir Michael Marmot mentioned earlier, and his research was absolutely clear. Poverty is the biggest single driver of ill health, and the biggest driver of poverty is Tory austerity.